Hi, everyone, and welcome. I'm Fabio Castiglione. I'm a consultant urologist and andrologist, and today I'm speaking on behalf of Holistic Andrology Clinic in London. Just a quick note before we start. This session is educational, not personalized medical advice. If anything we discuss rings alarm bells for you, please speak to your GP or healthcare professional. And if you ever have severe symptoms like heavy bleeding, chest pain, or serious shortness of breath, treat that as urgent and get immediate help. All right, let's get into it. Taking control, men's cancer, prevention and early detection. Today is about one simple idea: control. Cancer conversations can feel scary, but the aim here is not fear, it's being proactive. A lot of cancers develop slowly and quietly, and that's exactly why prevention and early detection can make such a big difference, both for survival and for quality of life. Think of this as a practical session: what matters, what to watch for, and what actions actually move the needle. So, why focus on men? Because men on average are more likely to delay, to minimize symptoms, and to avoid checkups. Sometimes that's cultural, I'll be fine. Sometimes it's logistical, work, time, access. But the effect is the same. People show up later when things are harder to treat. The good news is many bad outcomes are not inevitable. A big chunk of cancers are either preventable, detectable earlier, or managed better when men engage earlier with healthcare. Very quick basics, no heavy science. Cancer is when cells start growing in a way they're not meant to. They ignore normal control signals and sometimes they spread elsewhere. Importantly, cancer usually develops over years, not days. That means there's often a long silent phase, no symptoms, when early detection can really help. And cancers are named by where they start. Prostate cancer starts in the prostate, lung cancer in the lung, and then they affect organs by disrupting function, blocking pathways, and draining the body's energy. This slide is the why bother slide. Early detection often means higher chance of cure, less aggressive treatment, better quality of life, preserving things men care about like continence, sexual function, independence, and a lower burden overall, less disruption to work, family, finances. Early detection happens through two things: knowing warning signs and using screening where it exists. Let's name the big ones. Lung cancer, still a major killer, strongly linked to smoking. Colorectal cancer, common, often starts as polyps, and screening can remove these before they become cancer. Prostate cancer, very common, sometimes slow, sometimes aggressive. Skin cancer, especially in people with a lot of sun exposure. Melanoma is dangerous but very treatable if caught early. So we're going to cover prevention first, then screening, then a deeper dive into urologic cancers. If you remember one prevention message, it's this: smoking is the biggest avoidable cancer risk. It's linked to lung cancer, of course, but also bladder, kidney, pancreas, mouth, throat, you name it. And quitting helps at any age. Benefits start quickly and build over years. If you've tried before and it didn't work, honestly, that's normal. Quit attempts are part of the process. Support can include nicotine replacement, medications, counseling, and structured programs. Alcohol is often seen as just lifestyle, but medically it's a recognized carcinogen. Higher or regular intake increases risk for cancers like liver, mouth, throat, esophagus, and colorectal. And when alcohol combines with smoking, the risk doesn't just add, it can multiply. The practical message: if you can reduce alcohol closer to low risk levels or stop, your cancer risk improves, and usually sleep, weight, and mental health improve too. Obesity isn't just about heart disease or diabetes, it's also linked to cancer risk: colorectal, kidney, liver, and even more aggressive forms of prostate cancer. Why? It affects hormones and inflammation across the body. So, what's the goal? Not perfection, a realistic protective pattern. More vegetables and fruit, whole grains, healthier fats like nuts and fish, and less processed meat and ultra processed foods. Think sustainable, not extreme. Exercise is underrated in cancer prevention. It helps regulate hormones and insulin, supports weight, improves immune function, and reduces inflammation. You don't need to become a triathlete. A simple target is move more, sit less. Brisk walking, cycling, swimming several times a week makes a real difference. A lot of people don't realize some cancers are linked to infections. Hepatitis B and C increase liver cancer risk. Vaccination and safe practices matter. HPV is linked to cancers including penis, anus, and throat. HPV vaccination helps. And broadly, safer sex and harm reduction reduce infection related cancer risks. This isn't about judgment, this is straightforward prevention. Here's the life stage approach: 20s, 30s, learn testicular self exam, sort lifestyle early, consider genetic counseling if there's strong family history. 40s, 50s, Talk about prostate screening, PSA discussions. Start colorectal screening as recommended. Regular health checks. 60 plus. Continue screening appropriately. Consider lung screening if high risk. Stay alert to new symptoms. And across all ages, if something is new, persistent, unexplained, don't wait it out for months. As a urologist, I'm going to spend a little time here. Urologic cancers affect areas men often feel private about: prostate, testicles, bladder, kidneys, penis. That privacy can delay help seeking. But these cancers don't just affect survival, they affect identity, sexuality, continence, quality of life. And early action can prevent or limit that impact. Prostate, understanding the gland. Quick anatomy. The prostate sits under the bladder in front of the rectum and surrounds the urethra. It contributes fluid to semen. And a key point: as men age, the prostate commonly enlarges, causing urinary symptoms even without cancer. That's why symptoms alone don't automatically mean cancer, but they do justify assessment. Risk factors: keep this practical. Age risk rises sharply after about 50. Most cases are in older men. Family history: father/brother/son increases risk. Ethnicity: men of African or Caribbean descent often have higher risk and more aggressive disease. Genetics: some mutations like BRCA2 can increase risk substantially. So if you're higher risk, screening conversations may start earlier. Important: early prostate cancer often has no symptoms. That's why PSA conversations exist. Later symptoms can include urinary frequency, getting up at night, weak stream urgency, blood in urine or semen, and bone pain in advanced disease. And this matters, these urinary symptoms overlap with benign enlargement. So the message isn't panic. The message is don't ignore it, get it checked. PSA is a useful test, but it's not perfect. Benefits: can detect cancer earlier before spread, can enable less aggressive options, including monitoring. Harms: false positives cause anxiety and lead to biopsies. Overdiagnosis, finding very slow cancers that might never cause harm. And if treatment happens, side effects like incontinence or erectile dysfunction can occur. So the best approach is informed decision making, especially tailored for higher risk men. If prostate cancer is found, treatment depends on risk level and patient preference. Active surveillance, monitoring low risk cancers carefully to avoid side effects. Surgery, radical prostatectomy for suitable men with localized disease. Radiation therapy, external beam or brachytherapy. Hormone therapy, lowers or blocks testosterone in advanced disease. And a reassuring line: many men diagnosed early live for years, often dying of other causes. The challenge is finding the dangerous cancers without overtreating the harmless ones. Testicular cancer is relatively rare overall, but it's the most common solid cancer in young men, typically 15 to 40. Risk factors can include undescended testicle, family history, or prior testicular cancer. And most men don't feel ill. They just notice a change, so awareness is everything. The classic sign: a painless lump or swelling in one testicle. Other signs: heaviness or persistent discomfort in the scrotum, a change in size or consistency compared with the other side. Occasionally, sudden pain if there's bleeding into a tumor. Key message: if you notice a change, don't watch it for a few months. Get reviewed. Testicular self examination. Here's the simple routine. Best after a warm shower. Gently roll each testicle between thumb and fingers. You're feeling for lumps, hardness, asymmetry, changes from your normal. Monthly is a good rhythm. And the encouraging part: testicular cancer is highly curable even when spread, especially with prompt treatment. Bladder cancer is more common in men than women. Big risk factors: smoking, certain chemical or dye exposures at work, chronic bladder irritation. The hallmark warning sign is painless blood in the urine. If you see visible blood, even once, even if it goes away, don't assume it's just an infection. It needs medical evaluation. How is it assessed? Urine tests, imaging like ultrasound or CT, and cystoscopy, a camera test to inspect the bladder lining. Treatment depends on depth. Non-muscle invasive tumors can often be removed through the urethra, sometimes with additional bladder treatments to reduce recurrence. Muscle invasive disease may require bladder removal and reconstruction plus systemic treatment like chemotherapy. Again, early detection usually means less radical treatment and better outcomes. Kidney cancer risk factors include smoking, obesity, high blood pressure, and some genetic conditions. Interestingly, many kidney tumors are found incidentally. Someone gets a scan for something else and it shows up. Symptoms when present: blood in urine, flank pain, abdominal mass, weight loss or fatigue in advanced cases. For localized tumors, surgery is key. Often we can do kidney sparing surgery if caught early. Penile cancer is rare, but it's important because it's often preventable. Risk factors: persistent HPV infection, poor hygiene, phimosis, tight foreskin, smoking. Warning signs: persistent sore or ulcer, color changes or thickening, bleeding or discharge, lumps in the groin. And I'll say this clearly: embarrassment is not worth the risk. Early penile cancers may need limited surgery. Late stage disease can require much more extensive treatment. Let's name the real reasons men delay: fear of diagnosis, I'd rather not know, fear of procedures, embarrassment, masculinity anxieties, practical barriers, work, appointments, waiting times, cost. These are real. But we can reframe the story. This is one of the most important slides. Strength isn't ignoring symptoms. Strength is knowing your risk, booking the appointment, asking questions, acting early. Being proactive protects your family, your independence, your future, and often means simpler treatment with less impact on sex life, continence, and day-to-day function. Here's the practical checklist. 1. Know your risk. Family history, age, smoking, weight, exposures, write it down. 2. Make lifestyle changes. Quit smoking, reduce alcohol, upgrade diet gradually, build movement into the week. 3. Engage in screening. Ask when colorectal screening should start for you. Discuss PSA testing in midlife, earlier if higher risk. 4. Respond to warning signs. Blood in urine or stool, testicular lumps, persistent cough, unexplained weight loss, changing moles, don't delay. 5. Use support networks. Partners, friends, community. Men do better when they're encouraged and not isolated. Key warning signs. Never ignore these. I want to slow down here. If you remember nothing else, remember these. Blood in urine or stool, visible blood needs evaluation. New lumps that persist more than a few weeks. Persistent symptoms, cough, weight loss, fatigue, urinary symptoms that don't settle. Changing moles, asymmetry, irregular border, multiple colors, changing size. The theme: persistence and change matter. Don't normalize things that aren't normal. These numbers exist to make one point: early action works. Testicular cancer has very high cure rates when detected early. Colorectal cancer can often be prevented through screening by removing polyps. And a large proportion of cancer deaths could be prevented through lifestyle changes and earlier detection. So, from a general perspective, lifestyle, screening, awareness. From a urology perspective, don't ignore prostate, testicular, bladder, kidney, or penile symptoms. You don't need to live in fear. You just need to stay engaged. Prevention works. Screening saves lives. And action is empowering because taking control of your health is one of the strongest things you can do. From Vira Health and from me, thank you for listening. If you're watching live, we'll move into Kwanda now. And if you're watching later, I'd encourage you, pick one action from today and do it this week. One appointment, one lifestyle change, one conversation. It adds up.